What exactly is premature ejaculation, and are there any treatment options for it? We're going to discuss that today. I'm Dr. Clay Williams at University of Texas Health East Texas Medical Center in Tyler, Texas, also working with Elite Enhancement of East Texas. So let's start with what normal ejaculation is. Well, first of all, there's nerves and hormones involved with sexual excitement and sexual function. That's a no-brainer. And so for men, the semen, comes from the prostate gland, the seminal vesicles, which are two little pouches on the back side of the prostate, and then the sperm, which is the smallest amount of contribution to the volume of semen, comes from the testicles. And the normal ejaculate is somewhere between 1.5 to 5 milliliters. And the more you abstain, the more sexual excitement, it can be a larger volume. But what happens is there's a rhythmic contraction because of the nerves, the brain signals that to happen, and all three, the seminal vesicles, prostate, and testicles, emit their fluid into the prostatic urethra, and that's called seminal emission, and that's controlled by the parasympathetic system. The way we learn that is P for parasympathetic is the same thing as the P for point. So it allows you to get an erection and then to actually have the seminal emission. But the sympathetic response, the S for shoot, that is what actually expels, that's the expulsion of the semen out of the prostatic urethra, down the length of the urethra and out through the meatus. So that's how it works. So what is premature ejaculation? Well, it's defined different ways, and of course it could be individualized to you. But bottom line is the AUA guidelines, the American Urology Association guidelines, basically says it's when a man ejaculates quicker than he wants to, and that's typically before 2 to 3 minutes. Now, some of you are listening to this and watching this, and you think that 2 to 3 minutes is terrible. That's way too fast. Some of you are watching this and thinking, I would take that because my seminal expulsion, my ejaculatory latency is much quicker than that, and that's the issue. It's really going to be more of what you're comfortable with, how it affects your life. But the typical answer is ejaculation before 2 to 3 minutes. Now, premature ejaculation has been found to be 1 in 3 men. Again, when you look at those questionnaires from the studies, it all depends what you think is too quick. But many times men ejaculate within the first 30, 40, 50 seconds of penetration. Now, most of these studies are not done with masturbation. They're not done with a partner who is stimulating them, and it's not with rectal sex, if you will, rectal penetration. These studies were all done with vaginal penetration, so take it for what it is. And what they look for is what's called the intravaginal ejaculatory latency period, or the IELP. And again, it was found to be significant when it was less than 2 to 3 minutes in men. Now, the studies show that the average time of what we call normal ejaculation in men is really 5 to 6 minutes. So it's not as long as perhaps many of you anticipate. The average man ejaculates within 5 to 6 minutes of intravaginal penetration. When you ask those guys on some studies that have been done, some pretty recently, the men on average say that they would like for the ejaculation to occur somewhere between 13 and 14 minutes. So not bad, but still not this 30-minute session of intravaginal sex that a lot of men are anticipating or thinking about because of the pornographic industry. What a lot of people don't realize that in pornography, those aren't filmed non-stop. There's complete intermissions where they start, stop, start, stop. But that's part of the problem with pornography. It looks like these guys and girls are going on for 20, 30, 40 minutes, and that's just not the norm. Interestingly, when you talk to women about what they would like from a man, including foreplay, they would like, on average, the sexual interplay most time to be between 30 and 37 minutes. Now, there's nothing wrong with having the quickie. There's nothing wrong with having something intermediate. And when they did the studies, no woman said that they wanted every sexual interplay to always be 30 plus minutes. But on the average, they thought that was an adequate time for what they feel connected with their partner. But if you ask the women on these studies, how much of that foreplay, how much of that entire sexual interplay do you really want true intravaginal penetration? And the average is about 14 to 18 minutes, so a lot longer. But men were looking at wanting 12, 13, 14 minutes. Women were just slightly higher at 14 to 18 minutes. So we have a discrepancy, right? If most men on average ejaculate between 5 and 6 minutes and they want 13 to 14 and women are wanting 14, 18 minutes, that still could be a problem, but it's manageable. But for the men who ejaculate less than 2 minutes, obviously this is not satisfying themselves or the partner based upon these studies. So what really causes premature ejaculation? Well, as you expect, we have a lot of different answers. And when you have a lot of different answers, it means we really don't know, right? Some people say it's stress, anxiety, depression that can cause it. But we also see that those same psychological and behavioral disorders can actually cause men to have erectile dysfunction and have delayed orgasms. So again, it's not really clear cut, but we do see some of these psychological and behavioral problems pretty high in gentlemen who complain of ejaculatory dysfunction and delayed orgasm. Obviously, there's some medications that can be involved, and when you seek attention with a urologist or a sex therapist, all this has to be looked at. But is there a biochemical problem with this? Well, a lot of people think that it's due to an increase in serotonin levels. Now, serotonin, dopamine, these are pleasurable hormones or substances, neurochemical substances, if you will, that are responsible for our happiness, that gives us our smiles on our face, that keep us from being depressed on a daily basis. And so taking a medication that increases the serotonin level in your brain should increase your happiness. So some of your antidepressants or your selective serotonin reuptake inhibitors, your SSRIs, such as Prozac, Zoloft, Paxil. And so that's why those medications are given. But one of the side effects of those medications is decreased sexual desire and delayed orgasm. So it makes sense that one of the medications or one of the treatments that we use to treat patients with premature ejaculation would be one of these SSRIs. The problem is we really don't have a handle on what the best dose and dosing is. Now, we can give 5 milligrams, 10 milligrams of some of these medications and achieve what we're set to do. But there's always a question, do you take a 5 milligram dose every day? Do you take a 10 milligram dose 30 to 40 minutes, an hour before sexual interplay on an as needed basis? Yes and yes. All of these are options. So when a urologist prescribes one of these medications, you kind of have to ask the patient, how would you like to do this? A low dose every day, an as needed dose, and then you have to kind of experiment with it and change the dose, change the dosing, and that's part of the technique in this. Obviously, you could also utilize behavioral therapy. Now, Masters and Johnson in the 70s came up with some techniques because the medications are only slapping a Band-Aid, right? It's not really treating the problem, because once you come off the medications, the guy will almost always go back into premature ejaculation. So to me, when I prescribe these medications, it's kind of a Band-Aid, but the true treatment is what Masters and Johnson has shown and has been studied countless times since then, would be either the stop and start technique. So just as you get close to having a climax, you have to stop penetration, stop sexual interplay until the feeling subsides, and then restart. Another option is the stop and squeeze. Very similar. You just stop sexual interplay and you give the penis a good firm squeeze. Obviously, the squeeze could induce ejaculation if you don't start or stop several seconds before expected ejaculation. And these techniques work wonder, and they actually do treat the problem if it's done on a routine basis.